Hi everyone. So a few people have requested that I did post the video that I was originally going to post before Rain's surgery. However, I thought, thank you Lucy, uh, treading in my dinner plate, sorry. I thought I would redo the video and add in about the surgery now that we've had the surgery and the healing process. As I know a few of you who have asked for the video have children who are going through the same situation, or surgery might be a possibility. I remember finding that there wasn't a lot of information out there. A good place to go if you do want more information or just a support group is there is a Vascular Ring support group on Facebook. If I can get the link, I will put it in. I do recommend that. So from the beginning, so I found out when I was 20 weeks pregnant at our anomaly scan that Rain had a right aortic arch. Sorry. Which at the time we were told something doesn't look right with his heart. I think it's a right aortic arch. Google it. Which is not great because there isn't a lot out there anyway. The only real things that are out there are vascular ring and vascular ring surgery. And even then, that hasn't got a lot of information on it. The screening process for right aortic arch is not very new, really. It's only in the last sort of 5 or so, it's probably more now that Rain's getting older, years that they've been able to see it on ultrasounds. So there isn't a lot of information out there. Boston in America is the sort of like pioneer for this. We're under Birmingham Children's Hospital and they have been brilliant, but I know there is also Great Ormond Street and Liverpool. There might be some more, I'm not sure, here in the UK. So we were told that and we were sent straight to Birmingham. So we went for a scan and they confirmed it was a right aortic arch, and we were offered amniocentesis for genetic screening. So to go into the medical side of it, we have arteries that come out of our heart, and for most people it is towards the left. Sorry, it might be flipped on my camera, I'm not sure if it'll flip it back. And some children, babies, and through to adults, because there are a lot of people who don't realise they even have this, so I hope that reassures some people that if you are told there is a right aortic arch, it may never ever cause issues. There are a lot of people who have no idea that they have one and really found out from some other scan. So it leans to the right instead, and what this does, it means it passes over our trachea and windpipe. Occasionally this will form a vascular ring, which is where it kind of tries to get back. Sorry, Lucy is eating mayonnaise off my plate. No, it tries to get back almost like a tree root, and it grows like ligaments around the trachea, the esophagus, windpipe, etc. And it can start to compress as it's trying to get back, and it'll get tighter and tighter. So your trachea should be rings, like stacks on top of each other, and if they are closed, they cannot grow with you, and that's why they are rings, so they can expand as you grow. There is a thing called tracheal stenosis, which means that they are joined, and a vascular ring can, not always, but can compress so it seems like it is a complete ring, which means it won't grow, which causes problems with swallowing, speech delay, breathing issues. A stridor is the main symptom, which is what Rain has. He sounds like a little Darth Vader if he exerts himself, or he eats, and he will choke quite often, and he takes a lot longer to get over a cold, and if he has a cold, the stridor is very strong. So this is all the stuff that we found out at Birmingham. We were offered amniocentesis because it can be a cause, a symptom of DeGeorge's syndrome. Amniocentesis is where they will put a needle into your stomach, straight through into the amniotic fluid, and they will take some amniotic fluid and send it away for testing. And this is a far more thorough and comprehensive check on genetical testing compared to the usual blood tests that you get. So DiGeorge syndrome can range from you don't even know you have it all the way up to quite life-changing symptoms such as dwarfism, delays in learning, brain damage, wheelchair bound, inability to eat and drink, etc. May not talk, it can be a very broad range. So we wanted to have it because we wanted to be prepared that if this was an option, we wanted to be able to research and, be able to give Rain the best and most comfortable life we could. Rain doesn't have it. The results came back negative. So we moved on to the next step, which was to stay under Birmingham Children's Hospital. I went and I had quite a lot of scans. I was also under a consultant at Stoke, and we had scans there, and it was the same consultant who'd done my amniocentesis. And we've had that same consultant all the way through. When Rain was born, he went off for an echo pretty much straight away, which is like an ultrasound on your chest, and ECGs, etc., which is the leads to monitor your heartbeat. He had got some holes in his heart, and also a murmur because of the holes. They have cleared up bar one, so he does have one hole, but at the moment the blood flow is they're happy with it. He doesn't need bypass surgery, luckily. As Rain got older, he started to develop more of the symptoms that we were told to look out for, as I said earlier. And it was one of those moments where I think because he is my rainbow baby, I have always been, and I have anxiety and health anxiety, I've always been a lot more, something's wrong. And, you go to the doctors and they say it's okay. And I personally go, oh, I feel a bit stupid now, and oh, I've overreacted, and but I'm glad there's nothing wrong. Unfortunately, in this case, they said yes, there is something wrong. So the consultant was really good. I rang him, and straight away I got a phone consultation. He had videos emailed from me of how Rain is when he's eating, to sort of hear the stridor, and straight away he was like, yep, we're going to go through the testing to see if it's a vascular ring. So we started with a CT scan. I had that earlier on in the year, I think it was April, which was a general anaesthetic. He went for a CT scan, and it confirms that his trachea, instead of being straight, had a dip in it, which was a sign of compression. So that was when it came to, is this tracheal stenosis or is it a vascular ring causing this, which, is a much easier surgery and can also be fixed. So that required a bronchoscopy. So we went back in May for a bronchoscopy. Again, general anaesthetic, had the bronchoscopy, and they could confirm there was compression there. As far as they could tell, it was from a vascular ring. What they then did was the next month, so June, so it was 3 general anaesthetics and 3 months, poor thing. He went for a more in-depth scope. I don't know what it was called, I'm afraid, with the ear, nose and throat department. So the first one was cardiology for the CT scan, respiratory for the bronchoscopy, and ENT for this last scan. And they managed to show us photos where the compression was. They were happy that it wasn't stenosis at all, that it was in the correct area, and that it was something that would benefit from surgery. All the consultants got together from ENT, respiratory and cardiology, and they said, yes, this is something that will benefit Rain's life. Some people decide to watch and see. We were told that he needed to have it done. So we were told it would be a 3-4 month wait. We heard that in July, and I got a call the Wednesday before he had the operation, still in July, mind you. So I was like, yeah, we got to I don't know, November, to say we've had a space on Monday, come in on Sunday. and that was a whole wide range of emotions, because I thought I had a lot longer, and sort of each step that we went through was more and more confirmation that this is happening, this is something that's happened. We've known about it for 2 years now, and it was like the final completion. So it was very overwhelming, but it is what it is, and we had to make sure Rain's okay. So we went down on the Sunday. Rain had his final meals and drinks before he had to fast for his surgery. We stayed overnight. They did a lot of observation on him, as you normally would if you're in hospital or going for surgery, which is also in hospital, but yeah. So the next morning we waited our turn. That was quite hard because it did keep getting pushed back. Obviously they have emergencies that come in, and I would far rather an emergency went before us, so we were nervous it was going to get cancelled and taken to the next day or even another time completely, which can happen. I don't want to lie and say, oh no, it's all fine, once you're in, because it can happen, and there were people there that day who did have to come back another time because of that emergency, and Rain was, earlier on in the list, thankfully. So the next day he went down for surgery. It was a very quick surgery, actually. They said expect sort of 4 hours, because obviously there is a lot of prep time that they have to do. They have to, get him onto breathing apparatus and, finalise the general anaesthetic. We held Rain whilst he had the general anaesthetic, as we had all the way through. We were able to give him a cuddle and a kiss and everything. They were really good. The anaesthetic team in Children's Hospital was always brilliant. And then we got the call to say he had come out and was in ICU. So whilst he was in surgery, what they did was a left thoracotomy, which they could do this surgery keyhole, but because of the size of Rain and the size of the area they were operating on, they needed more room to work. So it is a cut on sort of almost under your shoulder blade in between the ribs, and they go in there and they slightly move the lung out of the way, which doesn't cause any damage to the lungs, and they snip the ligament. If it's something that needs it, they can pop 2 stitches in to keep it aside. As far as I'm aware, they didn't do that with Rain. They didn't tell us if they did. And then they stitch him back up and they pop a drain in. So whilst in ICU, he had that drain in. The drain came out pretty quickly. There was a very small chance that he would need the drain to stay in. Sometimes when children have surgery, the drain can start to leak the fat from their milk or food, which shows that something's just not quite absorbing right, so they have to stay on the drain for a little bit longer. Luckily Rain didn't need that. He had a small pocket of air when they took it out, so they kept him on oxygen for a little while longer with the little tube, not a mask, which he hated. He tried to pull that out so many times, but anyway, he managed it through. The other risk was slight damage to the vocal cords. Because of where it is, they could bruise the vocal cords. I have noticed a difference in Rain's cry since he's been out. His speech, he doesn't talk properly yet, but everything else sounds normal, but his cry is a lot quieter and strained. But they did say the bruising will heal, and if it didn't, there is injections they can do for vocal cords that fix it basically. So whilst we were there, after we were in ICU, the drain had come out and he'd managed to eat a little something. We went on to the ward. The ward was a very intense place, I won't lie. Be prepared to need time out, and we certainly did. We took it in shifts, and we were lucky enough to get a room at the Ronald McDonald House on day 3 of being there. So I would go and sleep for 8 hours, Jamie would go and sleep for 8 hours, etc. Because there is a lot of children there, a lot of noise, a lot of things going on. They were very accommodating. The nurses were wonderful. Whilst he was on the ward, he did spike a bit of a fever. I don't know if it was a misreading or if it was a fever, because he didn't have one again, but they wanted to, you know, they take it very seriously if a child's had heart surgery if you have a fever, so they got him on antibiotics. So we were there a bit longer than we wanted to be, but obviously we've got to make sure he's okay. He did go a little bit tacky on his heart, as they call it, which is where it elevates and drops quite a lot, and he was elevating quite high. So they sort of took it very slow, easing him off the morphine. They also gave him potassium to make sure that everything was okay there and it wasn't a potassium issue, and the antibiotics as well helps with that. By moving him from the ICU to the ward, he was sat up in bed. He was very, very tired the first sort of couple of days, but then also he would have moments of pure hyperactivity. You know, the morphine, he would have it and he'd be running up and down the halls. So, you know, I was expecting a baby lying in his cot or on me or Jamie for God knows how long, and that was not the case at all. He was absolutely with it and raring to go. By the time we'd got set to leave, he was just on Calpol. I think by the time I'd been home for 4 days, he was down to once a day, and now we're nearly 3 weeks post-surgery now, and he's very rarely having it. He's finally back in a normal sleep schedule. I say normal, is what I mean is he was sleeping a lot more. He really struggled with his appetite at first. There was a lot of food that just didn't taste right to him, I think, and he just didn't want to eat. So he did lose a tiny bit of weight, but it was like 150 grams, nothing to worry about. And he's now back to eating as much as he did before, even if it is still slightly picky on the food. We'll be going in 4 weeks for a post-operative, because he is currently still on diuretics, which is to help remove fluid and regulate your fluid. He got quite puffy in the face after the surgery, and that came down very quickly. Trying to think if there's anything else I need to tell you. As I say, we were at Birmingham, they were brilliant. He will continue to have checks on the hole in his heart. I'm not sure if we're going to need any more checks post-operative. I think they might do another bronchoscopy to see how it heals. They told us it'll be probably about a year until all the symptoms completely go, as Osage has been damaged in the compression. So it's going to be quite soft, and it's just going to take some time to strengthen and open back out again. But all in all, it was a lot better than I could have imagined. He dealt with it so much better than I could have imagined. And yeah, we were in hospital for a week overall, so a day before the surgery and 6 days, the day of the surgery, and then 5 days afterwards, so 2 and 5, yeah. If there are any more questions, please feel free to ask. I'm always happy to help anyone else in this situation. I know it can be a very scary place, especially when it feels like you're alone in it. You're definitely not. I'm always here, always happy to answer questions, and I'm happy to keep updating on how Rain is, to help raise awareness, and also just to reassure even just the two of you who wanted me to do this video. So I hope that helps, and best of luck. Thank you.